So today we continue the committee's ongoing work to improve the health and well-being of Americans by discussing legislation that will reauthorize 5 important public health programs while we continue to prioritize the critical response to the COVID-19 pandemic that is devastating our nation. It's also essential that we continue our work to improve access to care. So we're going to hear from public health experts about what is working and what considerations this committee should take into account as we move forward on the 5 bills. I know that Chairwoman Esch has already described the bills, but let me just say a little more about them. The first bill, H.R. 2075, the School-Based Health Centers Reauthorization Act, authored by Representatives Sarbanes-Tonko and Upton, would reauthorize these centers. And those health centers are a powerful tool for achieving health equity among children and adolescents who unjustly experience disparities in outcomes because of their race and family income. And the authorization for school-based health centers lapsed in 2014, and it's important that we strengthen those programs with additional federal funds. The next bill, H.R. 4078, the Early Act reauthorization, that was introduced by Representatives Wasserman, Schultz, and Brooks, and it authorizes the Centers for Disease Control and Prevention to develop initiatives to increase knowledge of breast cancer among women, particularly for women under the age of 40 and those at heightened risk for developing the disease. Breast cancer, we know, has impacted too many families, and it's important that the CDC continue its work. We're also going to bring up H.R. 4439, the Creating Hope Reauthorization Act, co-sponsored by many members of the committee. This bill would permanently authorize the Rare Pediatric Disease Priority Review Voucher Program. This program has provided value to pharmaceutical companies who've made investments in rare disease programs, but it's also places a strain on the FDA. So we have to keep in mind that we should think carefully about whether a permanent authorization makes sense as opposed to shorter term. Next, H.R. 4764, the Transplant Act of 2019, reauthorizes the C.W. Bill Young Transplantation Program. This provides patients who need life-saving bone marrow and umbilical cord blood transplants with info and support as they go through the process. It also maintains an efficient process for identifying donor matches, increases the number of non-familial donors available for transplant, and expands data and research to improve patient outcomes. Our colleagues Matsui and Bilirakis have authored this and worked to secure funding for this program for many years. And finally, the H.R. 5373, U.S. Anti-Doping Agency Reauthorization Act. The Anti-Doping Agency is the national organization in the U.S. for Olympic, Paralympic, Pan American, and Para-Pan American sports. And this reauthorization will not only promote clean sports through testing, education, and research, but also use a portion of its funding to promote a positive youth sport experience. So I want to thank all the witnesses.